Hello, I'm Dr. Tim McFarland. I'd like to talk to you about COVID infections and particularly COVID vaccines. I feel qualified to talk to you because I've been in private practice for over 30 years. The last 4 years I've worked in emergency rooms, hospitalists, and nursing homes. So I've taken care of COVID infected patients. So does the vaccine work? So here's the numbers. In America, during the summer of 2021, about 300 Americans are dying a day from the COVID disease. 295 out of the 300 are not vaccinated. Most of these are older, but there are younger people who are getting very ill and even some deaths in a younger population with the Delta variant. There's, even with the Delta variant, only about 5 out of the 300 were vaccinated. You can look at Baton Rouge's hospitals, done an analysis of the ICU patients that have been vaccinated or unvaccinated and the patients dying in their hospital. And the ICU and dying patients in their hospital are completely unvaccinated patients. This has become a pandemic of the unvaccinated so far as severe ICU hospital stays and deaths. So yes, the vaccine does work. This week, the EMS in San Antonio has been completely overrun. And what's happened is there's so many COVID patients in the hospitals in San Antonio that they can't get their patients out of the emergency room into the hospital because there's no beds. When ambulances pull up with a patient, they can't offload them because there's no room in the emergency room. So they can't go get the next patient, which means if you have a car wreck, unrelated to COVID, if you have a car wreck in San Antonio, there's a possibility today that ambulance will not come to your assistance. Some people ask, is the vaccine safe? And they are concerned because it was done so fast. Well, it was done so fast because Operation Warp Speed was started in May of 2020, and it required and allowed money to go to the vaccine production, and it allowed the FDA to do review and passage from one phase to the next in days instead of in months or years as it traditionally takes. Some people then ask, well, if the vaccine is so good, why should I have to wear a mask? The CDC has recently changed that, and it's because the Delta variant is so much more aggressive than the prior variants that we've had. And by that I mean it replicates dramatically, it replicates fast, and it gets to a high viral load. So if you have a COVID infection with the Delta variant and you cough or sneeze, instead of expressing like 10 viruses, you're expressing 1,000 to 10,000. And in a day or two, instead of going from 10 to 100, you're going from 1,000 to 10,000 to 100,000 virus particles in your system. Because of that, even if you're vaccinated, you can get ill and you can spread viruses. And if you're unvaccinated, you're getting much more sick, you're getting a lot more people ill, and younger people are getting sick. Now, I want to talk about a system of reporting the vaccines because it's very important to understand where numbers come from and where data comes from that scientists and doctors are looking at. So there's a reporting system only for vaccines that anyone, layperson, doctors, pharmacists, doesn't matter, can report in information about a reaction to the vaccine or a reaction to the COVID infection. This information is looked at and is statistically analyzed in great detail. But it has a disclaimer on the website that it is raw data. And you have to statistically analyze raw data in great detail to get the correct information. I'm a physician. I depend upon the CDC and others that are more specialized to analyze this data and give me the summary of what I need to do, whether I need to wear a mask, whether I don't need to wear a mask, and what problems the vaccine is causing. I don't have the training to do that. But people who aren't trained as much as I am are taking the data, and that's why I'm saying there is one death that we feel like has been linked and caused by the vaccine. But a friend of mine who has no medical training, but he's a nice guy and fairly smart, claims that there's 1,688 deaths that have been caused by the vaccine. This data system is called VAERS, and if you're not careful, it takes a temporal relationship and it applies a causal relationship. So let me explain that briefly. If my mother, who is 98 years old, died the day before her scheduled vaccine for her COVID infection, it would not have gone on the registry as being caused by the COVID vaccine. She just died. Her life expectancy is recorded in days, not years. If she got the COVID vaccine and died the next day, there will be people who would look at that and say, oh, it caused another death. So they would increase the number of deaths caused by the COVID vaccine from 1,688 to 1,689 because of my mother. There is a high possibility my mother's death had no relationship to the COVID vaccine. And that's what detailed statistical analysis is needed. It's exactly like saying, if something happens within 2 weeks of you buying a car, then the car purchase probably caused that. How many people in America buy a new car and have a heart attack in the next 2 weeks? According to the misinformation of the analysis of the VAERS system, there might be people who could say, we have data proving that buying a new car has caused 5,000 heart attacks in the last year. Now, be very careful, because that's a time relationship, but that does not prove a causal relationship. In fact, I'll be a little bit more blunt. There are people who have gotten pregnant in a new car. I'm fairly certain, even though the timing might have been within 2 weeks of the purchase of the new car, that almost no one would give the causal relationship that the new car purchase caused the pregnancy. So most of the antivirus information comes from a small number of people who have looked at the VAERS system and the information on it, but they don't do proper statistical analysis of it, and they're giving lots of poor and misinformation. And this causes a lot of fear, because their analysis, when you look at the VAERS, the numbers are there to support their assumptions, but the analysis is not there to support their assumptions. I'm also upset because last week I saw a picture and a link to an article. It said, COVID infections and death are almost exclusively related to the vaccinated. I clicked on the link and there was no article. It didn't go anywhere. I did a little research and found the true article, which said COVID infections and deaths are almost exclusively linked to the unvaccinated. Someone had taken the UN off and changed unvaccinated to vaccinated. That was a malicious, fraudulent activity, and I don't know why someone would want to mislead the American people. So another area where there's a lot of misinformation is, do masks help? So this is actually one area I'm going to tell you 2 little research projects that you can do. Look briefly at the sun and think to yourself, as you blink quickly, how bright it is. And then put your mask in front of your eyes and look at the sun. Did you prove that your mask blocks a lot of the sunlight rays? Do you realize that sunlight rays are a smaller wavelength than the size of virus particles? The other is, virus particles are not spread by themselves. They're actually in respiratory droplets. Respiratory droplets are much larger than a virus particle, but that's how they're spread. So you can take a mirror and hold it 6 inches under your nose and sneeze and count the droplets on your mirror. Wipe the mirror off, put a mask on, and do that again and count the droplets. Did you just prove that wearing a mask decreases the number of droplets that come out when a person sneezes? So there's lots of things that you can do that you can prove masks help. Unfortunately, there are some people who are spreading disinformation. One is Dr. Gold. And she's developed a concept and has talked about that the pores in the mask size are larger than a virus particle. This is a true statement. I do not disagree with that information. What she doesn't tell you is that, as I just stated, the virus particles don't get transmitted by naked virus particles. They're in respiratory droplets. And respiratory droplets are much larger than mask pores. So she gives you just enough information that is certainly true that it's easily misleading. I'm curious how much misinformation has been given that discourages people from doing proper health choices and actions, such as wearing masks when they're instructed to, and from getting vaccinated. As a physician, if I give out false information, I'm committing malpractice, and if it's fraudulent, I'm committing an offense. I think we need to be careful if we're not trained and we're not doing the proper research to be repeating information that might be false. Do you realize that there are more Americans dying per day in America for COVID infections than there ever has been per day killed in war? COVID infection is a terrible disease, but we have ways that we can reduce the death rate from the COVID infection, and vaccines have been proven to decrease the death rate from 295 to 5. That's a tremendous improvement. Should I get a vaccine if I'd have the COVID infection? What's wrong with just having my natural immunity protect me? Your natural immunity is great for that variant that you were sick with. It may not recognize a different variant. The vaccine helps your body recognize all the variants of COVID that we have so far. The reason the Delta variant is making people who have been vaccinated sick is not because your immune system doesn't recognize it. It's because the viral dose exposure and the viral load go up so fast with the Delta variant that even vaccinated people are having a hard time fighting it off initially. So I've talked about a lot of statistics, a lot of data analysis, a lot of information, and hopefully it gives you a better sense of why you should get vaccinated and why you should listen to recommendations from your local physicians. I want to wrap up with 2 comments. And one, my local physician is Dr. Wright. I can tell you his address. I go to his office twice a year. I had a friend say, my personal physician tells me that my T lymphocytes are in good condition and that I don't need to get vaccinated. I personally want to make sure you understand the internet is not your personal physician. There's a lot of good information on the internet. There's a lot of misinformation, and we've talked about that. Please ask your personal physician, should I get the vaccine? And make sure you're talking with a physician that is in practice and that is seeing COVID patients, that is treating COVID patients. The other thing I'd like to do is talk to you from a more personal level. I want you to come into my world. I've intubated a patient who had a COVID infection, and they say, please tell my loved ones that I love them and I care for them. Please help me get through this, Dr. McFarland. Now, those same people are saying, please tell my loved ones I love them, I care for them. Help me get through this, Dr. McFarland. And please tell my family and friends I'm begging them to get vaccinated. Please get vaccinated. If you're not a scientist personally doing studies on COVID infections and vaccines in patients, stop telling people what to do about the vaccine. Stop telling people to not get vaccinated. Please repeat what my patients tell me. Tell your family and friends, get vaccinated. Thank you.